Here to discuss is Dr. Mehmet Oz, the Administrator of Medicare and Medicaid Services. Dr. Oz, welcome back to the program.
Thanks for having me on, Batya, and I love that introduction because you covered so many of the beautiful things the president discussed in his nationwide address. And the most favored nation concept has been an important one to the president. That's the one he calls me the most about because he's so incensed, as you pointed out. And I want to make sure folks understand this. We pay for the exact same products made in the same factory, put in the same bottle, 3 to 4 times more than the exact same products sold in Europe. And the reason for that, despite the fact that we fund all the research, is they could get away with it. So the president, who's a superb negotiator, said, go ask these people, look them in the eyes and say, what is going on here? And you know what? He was right. They look back at you and they say, we knew one day you'd come calling. We sort of were surprised no prior president brought this up. But all right, we'll play ball. We'll reduce our prices. Most favored nation pricing will be the gold standard. Help protect us overseas because other countries take advantage of us. The same way we forced NATO member countries to pay extra to defend themselves against an external threat, we're forcing those countries to pay money to protect against an internal threat, like cancer and other diseases. So the president's vision was correct. No one thought it could do it. Everyone said it was impossible. And it's not just Pfizer, which you mentioned, the leading U.S. company, leading European company, AstraZeneca. We have the infertility drugs are now in there. That hinders 1 in 3 American couples are under-babied. Now they can afford the medications, which are, ridiculously expensive in that space. And we even got the GLP-1 drugs, the weight loss drugs, the so-called fat shot that the president keeps talking about. Right? But those drugs are $1,200, $1,300. Here in Europe, they're $250. And so for Medicare patients, it's going to be $50. And then the government's going to pay a total of $250. So we're getting them at most favored nation drug pricing. All of this is a basic narrative, which is we want you to take your medications. We want the innovation in those medications, but we don't want you paying through the nose for them, and we don't want you going to the drugstore with sticker shock and saying, you know what, I can't afford this. So I'm going to walk away 1 in 3 times from taking treatments that we know would work, but you can't afford them.
Now, Dr. Oz, you had a big announcement as well this week on something unbelievably important when it comes to children and transgender surgeries. Tell us about that.
Well, President Trump had an executive order earlier this year insisting that we revisit the reality that boys are boys and girls are girls. And if you want to change your sex, as a child, you really should be hindered from doing that because we have no evidence that it makes a difference. And we shouldn't be paying taxpayer money towards that in any case. And so we've been working on it dutifully. I want to highlight that 53% of all children in America are insured by Medicaid and CHIP programs that I administer. And it is our moral obligation to help those at the dawn of their life, our children. So we're no longer going to allow federal taxpayer dollars to pay for the destructive operations, irreversible chemical treatments in children. From now on, doctors, patients, families, they're going to be protected. And the duplicitous doctors who have been involved in these procedures are not going to get away with it anymore. We're not going to pay them for their work. These are ill-gotten gains. I'm going to put some numbers on this, Batya. To build a penis in a child costs about $150,000.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.